So I have continued to work as much as I can, knowing full well that we have to get to universal health care. But I'm taking a different approach than I had in 93 and 94, where, I was basically representing the White House, and Bill and I had a strategy which turned out not to work. We have to get 60 votes in the Senate to pass universal health care. Now, once I get the nomination, I'm going to be campaigning for more Democrats and trying to explain to people, if they don't like gridlock, give me a majority to work with that is big enough that we can really get things done. When we look back on American history and you think about great moments like Medicare and Medicaid and civil rights and voting rights, there were big Democratic majorities, and there were enough Republicans who wanted to be part of progress for our country. There's so many other examples. So I know that the plan is not as important as the political coalition supporting the plan. Whatever plan we put forth, the contours are pretty well known because there are only a couple of ways to get to universal coverage. If you favor, as I know your editorial board does, a Medicare for all system, then you have to figure out where you get the votes for that and what the transition would be. But it's a really credible idea because Medicare has a very low administrative overhead percentage, far lower than private insurance. If you go with an employer mandate, then you have to figure out how you deal with small businesses and businesses that operate on a very slim margin and how much you would expect them to contribute and what the individual responsibility would be for those who were self-employed or who were seasonally employed and all the other permutations. If you go with an individual mandate, then we're finding out from what Massachusetts is going through, what's the level of subsidy you need, how do you get particularly young people to do it since they think they're going to be immortal and don't want to pay for it. And then there are combinations. You can open up the Medicare system to people between 55 and 65, which I think has a lot of merit because people start retiring early. They start getting all the ailments of aging, in that decade often. And there are so many people who are waiting till they get to Medicare. There was just a recent study done that proved what all of us know, which is that people save up all of their medical problems between 55 and 65 if they're underinsured or uninsured, so that once they get to Medicare, they breathe this big sigh of relief and start seeing doctors like crazy. And the good news is they get to see doctors. The bad news is I have, advocated for people who have a woman I remember who I tried to help when I was in the White House had a lump in her breast. She was 63 years old. She had no insurance. And her doctor said, well, we're just going to watch it. No biopsy because you can't pay for it. And then I could tell you a million examples like that. So opening up Medicare is an idea worth pursuing. Opening up the Federal Employees Health Benefit Plan for both employers who don't want to bear the cost themselves, but who can contribute something, and putting more Americans into the plan that provides such a range of choice where the federal government bargains for the options and the price, and then looking to see what role private insurance should still play.